Grab your coffee. We need to talk about your health and wellness. Up next on Medically Speaking.
We learn how to know the difference to managing your health wisely in urgent care and home treatment. How we can build confidence, explore self-care, and find transformative results for looking good. We learn about preventative measures in stroke care and staying healthy. See wellness insurance initiatives for adopting a wellness lifestyle. We learn about care, recovery, and treatment programs in Brunswick County, and how to change the anxiety issue at the dentist with the rehabilitative facility dog concept.
Let's get you back on track. Here are some of the innovative health and wellness services expanding to the Port City. Welcome to Medically Speaking, where we bring you expert advice to help you make informed decisions about your health and wellness. Today I'm joined by Dr. Olga Lemberski. She's a board-certified ER physician with Wilmington Health, and she's here to help us answer a question most of us face, which is, when do you go to the ER, when do you go to the urgent care, and when do you treat an illness at home? It's information that could save you time and sometimes even save a life. All right, I'm here with Dr. Olga Lemberski. She's a board-certified ER physician. Dr. Lemberski, as an ER medicine specialist, what are symptoms or signs that should send someone straight to the ER?
That is a great question. So when we think ER, we think things like severe chest pain. That means you could be having a heart attack, and I would go directly to the emergency room. Another significant symptom is weakness. So weakness on one side of the body, or numbness, difficulty speaking, that could be signs of a stroke, and that is an immediate indication to go to the emergency room.
And how does that differ from when someone should visit a urgent care?
So urgent cares are great resources for minor emergencies. What I mean by that are lacerations or scrapes, injuries to your ligaments like a sprain or a strain. Other things that urgent cares are great at taking care of are ear infections, sore throat, coughs, and cold symptoms. So that would be something I would visit the urgent care for. And then you can also offset the emergency room because it prevents all these patients from going to the ER for more minor emergencies.
What about common illnesses? When can people safely treat those at home?
Well, if you have a common illness like the cold or a low-grade fever, it's perfectly safe to treat your symptoms at home. Tylenol and ibuprofen work great for aches and fever. If you have a sore throat, I always recommend warm saltwater gargles. And if your nose is stuffy, there's over-the-counter saline nasal spray. Also, make sure that you get plenty of rest and stay hydrated. So water or electrolyte replenishment drinks are great for that. Now, if you have a minor sprain or a strain or a sports injury, always rest, ice, elevate, ibuprofen and Tylenol if you need it. However, if any of these symptoms are worsening or just not getting any better and it's been a few days, it's always important to get evaluated.
What about when a child gets sick? What should parents do?
Make sure the child is resting, so keep them home from school or daycare, and also watch their hydration levels because children can get dehydrated very easily, especially if they're not feeling well. So make sure they're drinking water, or there's over-the-counter pediatric electrolyte drinks. Also, use age-appropriate Tylenol and ibuprofen for fever if they're not feeling well, and make sure that they stay home until they feel better. Typically, schools want kids to stay home until they're fever-free for at least 24 hours without any fever-reducing medication. Also, we want their symptoms to be getting better and to make sure that they are feeling better. Now, very important, if they're not feeling better, or if their fever is very high, or if they're just not acting appropriately, or they're just very tired, it is a good idea to get evaluated.
Before we wrap up, what advice do you have for people who just are not sure where to go for care?
I think most importantly is if you're having significant symptoms like chest pain, which could signal a heart attack, or weakness, numbness, difficulty speaking, which could signal a stroke, is to understand that needs emergency care at the emergency room. Minor symptoms like cough, cold, low-grade fever, or aches and sprains can be taken care of at the urgent care or your family doctor's office. If you're just not sure, it's always worth a call to your family doctor's office because there's nurses who can help guide your decision on where to seek care. Now, I think the most important thing to remember, and the key, is to not delay your care for a serious emergency, but also make sure you're using the ER appropriately and not overusing it for minor complaints.
Thank you so much.
Thank you.
A big thank you to Dr. Lemberski for sharing her expertise with us today. Knowing the difference about when to seek emergency care, urgent care, and at-home treatment is key to managing your health and wellness. If you ever have questions about where to go, Wilmington Health is here for you. For more tips and resources, visit wilmingtonhealth.com. Until next time, stay well and stay informed. Plastic surgery is more than just aesthetics. It's about confidence, self-care, and transformative results. Whether you're looking for a surgical procedure or a non-invasive treatment, the expert team at Wilmington Plastic Surgery and Med Spa is here to help you achieve your goals. Let's sit down with one of their plastic surgeons and learn how they can help you achieve a more confident you. I'm here at Wilmington Plastic Surgery with board-certified plastic surgeon Mark Morgan. Dr. Morgan, what are some of the treatments that are available?
Well, here at Wilmington Plastic Surgery, we have a full menu of both surgical and non-surgical treatments. We've seen a trend recently for more natural, refined results. And ultimately, what procedures a patient need will be determined on their presentation, their goals, and their needs. We have a certified surgical facility here that's fully equipped. Anesthesia services provided by a board-certified team of anesthesiologists. And that really helps us deliver dramatic transformations for our patients. Procedures such as breast augmentation, breast lift, body contouring, procedures to treat excess and unwanted skin after significant weight loss are just a few of the procedures we're able to perform here.
What type of non-surgical medical spa treatments are available?
Well, we have two locations. Our other location is just off of Military Cutoff, and that location focuses on medical spa treatments as well as our consultation services. At that facility, you can get any number of non-surgical treatments, including Botox, injectable fillers, advanced laser therapies such as the Halo and Moxie lasers, which are fractionated laser therapies. In addition, we have treatments that focus on unwanted fat or even to help tighten loose skin and subcutaneous tissue. These are all coordinated with our estheticians and our aesthetic nurse team members in order to maximize the results and recovery for these non-surgical treatments.
How can the Wilmington community prepare for the upcoming summer season?
Well, my advice for anyone looking to prepare for the summer season is to focus on one of our quick recovery interventions or treatments, something such as the Diamond Glow, a light chemical peel, or one of our body treatments such as Cool Sculpting. These have quick recoveries, limited downtime that won't impact your summer fun. The other thing we focus on when summer comes around is adequate skin protection. So being diligent with your skin protection with sunscreen not only limits advanced aging that can happen from the sun, but it also protects us from skin cancer. And so it's important not only to apply the sunscreen, but to reapply as the day goes on.
Well, are there any exciting upcoming announcements from Wilmington Plastic Surgery that you can share with us?
Yes, Christina, we have two exciting announcements. First, we have a new associate joining the practice, Alex Smith. He'll be joining us here in Wilmington Plastic Surgery at the end of August. He's a Wilmington native, and so we're excited to have him come back home and join us here. Additionally, as you probably know, Wilmington Plastic Surgery has been serving the area for over 30 years. And in addition to all of the aesthetic services that we offer, we also do a considerable amount of reconstructive surgery, mainly breast reconstruction for breast cancer and also skin cancer reconstruction. And the month of May is Skin Cancer Awareness. And so we're hosting an event with the Mad Mole Brewing Company in May to just bring everybody out, raise awareness. Dr. Glenner and I will be bartending, pouring drinks for people. And so please check our social media and website for more details. We'd love to see everyone there.
Well, that sounds like an exciting event. I look forward to seeing you there.
Oh, that'd be fantastic.
Your aesthetic goals are within reach, and Wilmington Plastic Surgery and Med Spa has a treatment option for you. For more information or to schedule a consultation, go to wilmingtonplasticsurgery.com. That's wilmingtonplasticsurgery.com. Thanks for joining us. We'll see you next time. According to the CDC, in the United States, someone has a stroke every 40 seconds, and every 3.5 minutes, someone dies from one. Strokes are the leading cause of long-term disability and one of the top causes of death in the U.S. Today we're going to learn about preventative measures and stroke care from Novant Health, New Hanover Regional Medical Center. I'm here with Rebecca Gainey. She's a stroke coordinator at Novant Health Neurosciences Institute. Rebecca, what is a stroke?
So a stroke is a medical emergency. It happens when blood flow to the brain is blocked or slowed down, and this causes that oxygen-rich blood to not be able to reach the cells, so they quickly die.
Why are they so common in our region?
So here in southeastern North Carolina, we live in what's referred to as the stroke belt of the country. And that just means we live in an area that has the highest density, higher than all national averages for strokes. Here at Novant Health New Hanover Regional Medical Center, we treated 1,500 strokes alone just last year.
How would someone know if they're at an increased risk for developing a stroke?
So some of the biggest risk factors that we teach people is high blood pressure, high cholesterol, diabetes, things that we can work on too, like stopping smoking, eating healthier, and having an active lifestyle. And of course, knowing your family history is really important. That plays a big role.
What are some of the signs and symptoms of a stroke?
So we teach an acronym, Be Fast. If you've heard it before, we try and teach everyone in the community, including the schools. And it is an acronym, each thing stands for something. So B is for loss of balance or coordination. E is for a sudden vision change in one eye or both. F is for drooping or uneven smile. And A is for arm weakness or a little bit of numbness that you might have. S is for slurred speech or difficulty communicating and speaking. And T is for time, is time to call 911, because recognizing those symptoms quickly can definitely save a life.
So what should you do if you think you're having a stroke?
So you hear us say time is brain, and every second counts during a stroke because those brain cells do die so quickly. That's why it's critical to call 911 immediately at the first sign of a stroke. That fast action really gives you the best chance at recovery and allows for emergency teams to get to you quickly and start those life-saving treatments.
Novant Health New Hanover Regional Medical Center is considered one of the top in the nation when it comes to stroke care. What is it that you do that's so unique and impactful when it comes to caring for your patients?
So we are a DNV comprehensive stroke center, and what that means is we meet the highest national standards for stroke care, including advanced imaging, specialized stroke teams, and we're able to provide 24/7 treatment capabilities. And we're really proud to be recognized with some of these top awards from the American Heart and American Stroke Associations Get With the Guidelines. They measure us on a monthly basis, and that really shows our commitment to delivering high quality evidence-based care.
Can you share with us something that you're really proud of here at Novant Health?
Yeah, we have so much to be proud of here on the coast, from the IR team and the surgeons that perform our surgeries to the nurses up here on the 5th floor providing excellent stroke care, and the neuro teams that meet you down in the ER to diagnose your stroke. We really have a great team. One of the things that I could point out that we focus on is not just fast treatment, but great treatment, and we really measure these consistently. One of our things that we measure is door to needle time, which is the time that you arrive at our hospital until when you receive that clot busting thrombolytic medication that helps stop the clot. We consistently meet and even beat the national goal because every second really counts. And we don't just stop our care when you leave the hospital after your stroke. We have stroke support groups that you and your loved ones can join, and we do a lot of activities out in the community that really kind of keep you healing and on your journey.
Thank you for sharing all of this valuable information with us. As we wrap up this Medically Speaking, I hope you found this information helpful. Remember, your health journey is uniquely yours. Don't forget to celebrate those milestones along the way. We'll see you next time. Health insurance can feel overwhelming, but it doesn't have to. Today I'm joined by Conette Bradley, the owner of NC Insurance Advisors, and she's here to help you find the right coverage for your needs. I'm here with Conette Bradley. She's the owner of NC Insurance Advisors. Conette, when someone's trying to figure out which health insurance plan is right for them, it can get real confusing really fast. So what are some reasons that people come to you for help?
Because it is confusing. Whether you're under 65 or on Medicare, it is very confusing. And government websites are not as easy to use as you would think. But they come to us because we know what we're doing, they get the information, we help them with their choices, we simplify it and follow up. We're here all year so they can come back and ask questions or come in if they have claims issues. So we're here for our customers.
When someone's shopping for a health plan, what are some questions that they should be asking?
Actually, we have to ask the questions mostly because we have to know what your projected income is for the year that you want coverage, how many people are on your tax return, and all of those things determine what plans are offered to you and whether or not you qualify for a subsidy from the government, also known as an advanced premium tax credit. Now, those have been very beneficial for many people who now have zero premiums and extremely low copays and out-of-pocket maxes. However, people who don't qualify for the subsidy because of what they earn, the benefits are not good. Maximum out-of-pocket over $19,000 for a family. It's unaffordable. And we have a different demographic now going without coverage. And since North Carolina expanded adult Medicaid, which is ages 18 to 64, December 1st of 2023, now we have lots of people who are getting subsidies being sent to Medicaid. And if you think about it, Christina, it's economics. And if Medicaid reimburses this much and Medicare reimburses this much, and commercial insurance reimburses this much, who are you going to see? You have to pay your staff at the medical office. So there are a lot of things that are not right. People don't have the choices they used to have. And oftentimes people end up earning more than they thought they would, or they have to take money out of their 401k because they need a new roof, or they have other medical expenses. And then they have to pay all the subsidy back. And they find out the next year when they file that tax return. And it has been devastating to many. And I do have clients who can afford to pay $2,000 a month or $2,500 a month for a couple, but they refuse to do it for the benefits that come with that price. Also, health savings accounts. They're great because you have skin in the game to pay for your little things and tax advantages. Some counties you can't buy an HSA because they're not sold on the exchange or where you are dealing with the government in the middle of your health care. Therefore, you have to pay full price if you want an HSA. So choices are very limited. Benefits are all over the place, and so are the premiums, from zero to $3,000 a month, a mortgage, and people are just upset with losing choices. Now, they do have to ask us about, is there a doctor in the network? They have to ask that question. But oftentimes, there's only one network in their county. And, so people are having to take different doctors that they aren't used to. And with the Medicaid expansion, so many people lost their subsidies and got put on Medicaid, and they can't find a physician. They can't get an appointment for 8 months. I think there's one eye doctor for Medicaid in Wilmington. Another friend of mine on Medicaid was given a dermatologist in Clinton, and the appointment was like 8 months out. So things are not as smooth as some would like to think.
Do you also help people on Medicare and those just turning 65?
Absolutely. We have a lot of people who move here because of their grandchildren, and we help them change their Medicare plan. And of course, during the annual enrollment, when they can sign up or make changes on their plans, that's October 15th through December the 7th. We do a lot of assistance during that time because so many plans change for the new year. But yes, we help a lot of people turning 65 and those already on Medicare.
Conette, thank you for sharing your expertise with us today. Thank you for joining us as well. If you're looking for help in navigating your health insurance options, NC Insurance Advisors is here to help you. Thanks for joining us. We'll see you next time. In 2024, our nation saw a glimmer of hope. Drug overdose deaths declined by nearly 24%, the steepest drop in years. But behind that progress means more than 87,000 families still lost someone they love to addiction. The battle isn't over, and that's why programs like the Anchor Initiative here in Brunswick County are so vital. They're not just changing statistics, they're changing lives. I'm here with Brunswick County Sheriff Brian Chisholm. Sheriff Chisholm, tell us about the Anchor Initiative. What inspired this program?
This is a life-saving initiative that we started back in 2018. We learned a long time ago here at the Sheriff's Office we cannot arrest away the problem of addiction. We take away all the barriers. We handle the funding, we handle the transportation, and we educate the citizens about the program. We truly want people to get the help that they need and they deserve.
Nowadays, everyone knows someone with an addiction. What is the first step to getting started?
The very first thing they need to do is they need to realize that they need and want help. After that, they can call the Sheriff's Office, they can call 911, they can find a deputy on the street, walk up to them and ask them, and we'll get them the help that they need.
Once someone decides to get help, the first person they're going to talk to is the Anchor coordinator. His name's John. We're going to go meet him now. I'm here with the program coordinator for the Anchor Initiative, John. John, what happens after someone reaches out for help?
So it all starts with a conversation, and we give a general assessment for each individual that calls. We determine if they need detox right away. We determine if inpatient or outpatient would be best for them. And from there, we provide the transportation, we provide the knowledge, because we work with about 12 different facilities in and out of our state, and we provide the funds needed to get these individuals into treatment.
The Anchor Initiative is for any Brunswick County resident struggling with drug or alcohol addiction, but what if that person is incarcerated?
So if an individual is incarcerated, they can also apply for the Anchor Initiative program, but for ones that are unable to get out of our detention center, we also have the ARROW program. And the ARROW program is essentially the same thing as the Anchor, it's just within our detention center. It's a 90-day program that we provide here at the Sheriff's Office.
What impact has this program had since starting in 2018?
So before launching the Anchor Initiative program, we researched several programs across the country, and we assessed the needs of our own community and found that the three biggest barriers that our community had was funding, transportation, and the lack of knowledge. So we provide the funds to get individuals into treatment. We provide the transportation to get individuals back and forth from treatment, and we provide the knowledge for the treatment facility that would best fit that individual. Since then, our program helps about 150 to 200 people a year get into treatment. Those individuals, we vary between 50 to 60 people in treatment at all times. We have about 50 or so graduates each year. We've seen a decrease in overdose-related calls. We've also seen a decrease in property crimes and a strong community bond because of the Anchor Initiative program.
How is this program funded, and how can we as a community support it?
The Anchor Initiative program is funded through 100% donations from the community. Our community support is what keeps this program going. So how you can help is to help spread the word or donate to our program, because any support from the community is a life saved.
Thank you for sharing all this valuable information with us. Now we have a special message for you from your Brunswick County Sheriff, Brian Chisholm.
As your Sheriff of Brunswick County, I'm here to let you know that this program is for you. When you are ready, we will be standing by. Recovery starts with a conversation. We want to help you. We know you can't do it alone. All you have to do is reach out and call us. Thank you.
If you or someone you love is ready for a fresh start, Anchor Initiative is here. Call today or scan the QR code on the screen and take the first step toward recovery. Going to the dentist, not your idea of a good time? Well, Thrive Family Dental has changed that concept. They are the only dentist in Wilmington with an approved rehabilitative facility dog. This is Meadow, and we're going to learn how she's helping patients feel more at ease while at the dentist. I'm here at Thrive Family Dental with Dr. Ben Freeberg. Dr. Freeberg, nearly 1 in 3 people struggle with dental anxiety going to the dentist. Why do you think that is?
The main reasons for dental anxiety are typically past trauma at the dentist. Having a dentist that didn't listen to you, caused pain when you weren't numb, and also some other traumas in life can lead to that as well. It's also a really intimate, kind of claustrophobic space, and so it can lead people to feeling uncomfortable at the dentist.
What do you do at Thrive Family Dental that makes going to the dentist less scary?
It's a great question. When I designed this office, I tried to create a practice around the question, how do we make going to the dentist suck less? And so all of the design decisions that we made, from the size of our operatories being large with big open air spaces, large windows for natural light, to reduce claustrophobia. We don't have any pictures of teeth We don't have any pictures of advertisements, because this is a medical facility that's based around building a relationship of trust. So we make sure that we go out of our way to establish that relationship. Some of the other things that we do is a full practice tour. We want all of our patients to be familiar with the environment and the people they're going to be working with before we start doing any sort of exam or treatment. We make sure that we have amenities. We have Netflix. We have noise canceling headphones. We have lavender weighted eye masks. We have warm towelettes for after appointments if we've gotten messy at the dentist, right? So all of these things are in place for us to help our patients with anxiety. But kind of the big one is Meadow. So she is a full-time rehabilitative facility dog. She's been trained to work with individuals with anxiety. So she can come into the room, help break any tensions, help people feel more comfortable in that space. And she can really tell when a person is having anxiety. And she really likes to support those people during those times. One of the things that we really enjoy with our patients is what's called deep pressure therapy. That's where the dog will jump up onto the patient's lap while we're working and lay down on the patients to help them through those procedures if they're having a difficult time.
For someone who's been avoiding going to the dentist for years now, maybe due to fear, and now has some serious dental concerns, how can you help them fully restore their smile?
Whenever a patient hasn't been to the dentist in a long time, the first thing we do is establish trust and then goals. Once we know what the patient's goals are, we can then go into getting the great data that we need through latest technology and then creating a comprehensive care plan to restore them back to the smile that they really want.
You see a lot of patients that are nervous and finally take the leap to come in. What are your patients saying about their experience at Thrive Family Dental?
One of my greatest points of pride as a dentist is when we get a Google review that's 5 stars and it says, "I used to hate going to the dentist." For me, that's the greatest compliment that a patient can give us, because we've taken someone from fear and anxiety that's prevented them from coming for years. And now coming back to the dentist, they've been able to conquer that. And the patient truly gets to be their own hero. And we get to be part of that journey with them. And it's really nice to have Meadow on board, an amazing team, and everybody all aligned for the patient experience so that they can write that Google review at the end that says, "I used to hate the dentist, but I no longer do."
As we wrap up this episode of Medically Speaking, remember, going to the dentist does not have to include anxiety. It can actually be fun. We hope you found this information helpful. To schedule your next dental appointment, reach out to our friends at thrivefamilydental.com. That's thrivefamilydental.com. We'll see you next time. That's it for this edition of Medically Speaking. You can watch any of these segments and get more information anytime on foxwilmington.com. We'll see you next time.